Hello, my name is Abu Zar Said from Sudan. I live in Khartoum, capital of Sudan. 2020 was very challenging year to the whole world and to my country as well, from the beginning of Covid-19 to many lockdowns measures to many difficulties in economics as a result of those lockdowns. From the beginning, the term Covid-19 was very interesting topic to me, so I started to search online about these topics, and I realized there was a new virus that was first time identified in Wuhan, China. So I started to take my precautions, from avoiding crowds to social distancing to wearing a mask and to wash my hand frequently. Situation here in my country, I think it was and still very confusing, because at earlier stage in March there was a few cases, and all of those cases were imported cases. At a certain time the health authority here they try to organize their effort to detect every single cases and to put them in quarantine. At earlier stage tests were available to people, but unfortunately there was a huge cases, and cases start to grow. At a certain time people start to ask for those tests, but unfortunately tests were not available for everybody. At April, hospitals were full of patients. The need of oxygen was very high, and situations goes very bad, because everybody here in Sudan, he realized, even in his near circles, there was a lot of community spread. There was a lot of death. Most of them, they don't know if they passed by, the cause of death was COVID or something else, but everybody realized this virus is very dangerous and has the ability to spread very fast. Government tell people to stay at home if it is possible, but most of people here, they don't have the luxury to stay at home for a long time, because they have to make their living in daily basis. So many people start to complain about stay home orders, and government start to applying some kind of restrictions, as the curfew start to take place in certain times. By I think June and August, situation became much better. Cases declining very fast. Deaths as follow that. That's declining. By time people start to think maybe this COVID is end, and they start to change their behavior again. They start to go and visit their families, and they start to socialize, get more social. Even they start to organize their wedding, they start to organize big events. So as we always know, the virus found his way again and start to spread again in the community. By October, things start to become worse, and cases start to rise again. Deaths follow that rise. By time people, some of them, they was shocked, because they realize this things is not over yet, and they start to change their behavior again. Few workplaces were opens for the public, and I think most of workplaces, they start to reduce their workforce in the workplaces. Work time, reduce it from 9 to 3. All the people who don't have a specific workplace, or they work in the market, they complain about these lockdowns, and they start to protest about these lockdowns. But I think in the end, situation became very dangerous, and cases, I think, is still very high in Sudan, but the test capacity is not that high. At certain time, most of people here realize this virus is very dangerous and has ability to spread very fast. This all from Sudan. Thank you, Dr. Campbell, for letting us to explain the situation here in our country. So as you always says, thank you for watching as always. Abu Zara Said from Sudan. Thank you, Dr. Campbell.